Hi, this is Marcy White at Copley Acupuncture, and I wanted to make a video today discussing something called auricular acupuncture. This is one of my favorite styles of acupuncture and methods. There's a lot to it. I'm just going to give you a brief history, but basically, some people have seen this in recent years in media, a lot of celebrities walking around with these little balls and Band-Aids in their ear. And I have a lot of people coming in asking me what this is. So auricular acupuncture has a very, very long history. It goes back almost 1500 BC in ancient Egypt. There's ancient medical writings talking about using areas of the ear to treat gynecological disorders. And even Hippocrates in ancient Greece talked about using areas of the ear to treat impotence and male sexual health. So what they would do is they would stimulate areas of the ear by cauterizing it or burning it. In the 1950s, this is when this really came to light as kind of a whole system of treatment. And so we credit this with Dr. Paul Noget. He was a French doctor, just a general practitioner who had patients coming in with these cauterizations, and they'd been to Corsica and had their ears burned, and it cured them of their sciatica. So he spent his entire professional career researching this. And so he's kind of credited with first mapping out what we call the ear chart. Basically, I'm going to give you, again, just a very brief explanation, but your ear is a map of the entire human body. So if you look at the ear, you'll see a fetus represented here. And so this shows where the different correlations are in the human body to the ear. So your head is represented in most of the lobe area, the neck and spine. You can see the limbs here. As more and more research has evolved over decades, what's come to light is that this is 100% true, that you can access any part of the body through the ear, and there's these correlations. And this technology was done with functional MRI. So basically in a functional MRI, you're seeing brain activity in real time. And what they would do is put someone in the functional MRI, pick an auricular zone. So let's say we're gonna pick the zone for your thumb. So you can stimulate that with electricity or with acupuncture. And you can see in the functional MRI a topographic zone that relates to the thumb light up on the brain. So every part of your body has these zones on the brain. And when you stimulate its correlated area in the ear, it lights up. It's absolutely fascinating in my opinion. So there's a number of different ways that this can work. There's so many different styles of auricular acupuncture and different schools of thought, different charts. There's a Chinese chart, there's the French system, there's a German system. So as some of these systems have evolved, they've included more and more points into their system. So you're actually not just seeing that the cervical spine or the spine is here, but you're seeing each segment of the spine and glands and the endocrine system. And it's just fascinating how many points there are. So the next question is, how do you find these points? There's so many. So there's a number of ways. One is that you can use something, we use this in acupuncture, called the pointer XL. What it does is it reads electromagnetic frequency on the surface of the skin. So where there's a dysfunction, you'll see a reduced electromagnetic frequency. So when this is placed on an area in the ear, there's hundreds of points. As you hear a large or a loud tone rather emerge, you'll know you're on a point. So if you listen, you'll hear when I'm on a point. And so that is an area that we might want to treat. Let's, look at what this area is and what's going on with the person and see if this seems like an accurate area to treat. So this is one branch of what's called the vagus nerve. And if someone's having digestive issues, trouble sleeping, a lot of anxiety, then you want to treat it. So you can actually use the pointer XL to treat the point by giving a little electrical pulse. You can use an acupuncture needle. When you're done with the treatment, you can also put in place what are called press needles or press balls. A press ball is made out of a seed called a Vacaria seed or a magnet, or in this case, this one's a little tiny needle on a Band-Aid, and you just place it in the ear and it's left in place for anywhere from days to a week. And what it does is it continuously stimulates that point so that you're getting the effect of that over time. So if somebody is coming for anxiety and we've done our acupuncture treatment and given them some lifestyle recommendations, and we can place this in the ear point. If you're using the seed, you can press it yourself as you feel like you need it, or if you use the needle, you can just leave it in place for periods of time and let it do its thing on its own. There's this really interesting physician, acupuncturist, who has developed a system where she takes just her cell phone and turns the flash on and takes a picture of the ear, and you can see regions where there's dysfunction by seeing discolorations like red or purple or swellings. And this is just, you pick up a lot more than the naked eye can. I've done this with a lot of my patients recently, and sometimes we've taken pictures before and after and been able to see that it changed within a treatment. So that is really just absolutely wonderful too. So auricular acupuncture, again, it's been around for centuries. There's a lot more to it. I hope this has given you a little taste and piqued your interest. And if you have any questions or you're interested in any more information, please let me know. And I appreciate you watching. Thank you very much.